Transforming your life with hypnotherapy just got easier with your host, Julie from CoachingHypnosis.net.
Welcome back, dear listener, to Coaching Hypnosis. In our last session, we discussed the ethical guardrails of pain management. Today, we delve into the first practical tool in your toolkit, the deliberate, clinical use of language. We are working through the 13 foundational tools of clinical pain management. 1. Direct suggestion. 2. Indirect suggestion. 3. Amnesia. 4. Sensory alteration. 5. Symptom substitution. 6. Symptom displacement. 7. Disassociation. 8. Reinterpretation, reframing. 9. Confusion. 10. Gradual dominion. 11. Regression to pre-pain period. 12. Pseudo-orientation in time. 13. Time distortion. In a world of clinical hypnosis, the words we use are not just descriptions, they are the commands to the nervous system. As Dr. Michael Yapko highlights in trance work, the word pain itself carries a heavy, negative emotional weight. It acts as a trigger, instantly calling up a lifetime of memories, of helplessness, of medical appointments, of fear, and of suffering. When we use the word pain, we are intentionally reinforcing the very neural pathways we're trying to quiet. To change your experience, we must first change your vocabulary. In a professional clinical session, you will notice that a highly skilled hypnotherapist will almost never use the word pain. Instead, we substitute it with words that describe the raw, physical reality of the sensation without the emotional baggage. We use words like pressure, tightness, discomfort, temperature, or simply the sensation. Why does this matter? Because pain is an interpretation. It is a judgment your brain makes about a signal. When you describe it as pressure or an uncomfortable sensation, you are shifting your brain's role from a victim of suffering to an objective observer of data. You are moving from a reactive emotional state to a neutral, analytical one. This is a subtle but profound shift. By stripping away the label of pain, you are essentially telling your brain, this is just information. It's not an identity. When you practice self-hypnosis, I invite you to try this immediately. The next time you notice a familiar discomfort, do not label it as pain. Observe it. Is it tight? Is it hot? Is it pulsing? By giving it a neutral descriptor, you break the cycle of panic that typically follows, effectively turning down the volume knob of your own distress. Tomorrow, we move into the first of our active hypnotic techniques, Tool 1, Direct Suggestion. We will explore how to give your subconscious mind the clear, specific instructions it needs to initiate a state of comfort. Thank you for listening to Coaching Hypnosis. As insurance providers increasingly pivot away from high-risk pharmaceutical coverage in favour of sustainable, non-pharmacological alternatives, there has never been a more critical time to elevate your clinical expertise. We are dedicated to providing the evidence-based tools you need to position your practice at the forefront of this shift, helping patients reclaim their health without the shadow of dependency. Visit CoachingHypnosis.net to deepen your clinical knowledge and lead the charge in modern pain management. Mindfully yours, Julie.